Have you ever wondered if some medical tests are actually doing more harm than good after the age of 65? It may sound surprising, but not every screening, scan, or checkup is beneficial for older adults. In fact, some tests can lead to unnecessary stress, false alarms, invasive procedures, and treatments that may never have been needed in the first place. Today, we're discussing 5 medical checkups that many doctors think twice about recommending for healthy seniors over 65. Now, before we begin, let me be very clear. This is not medical advice, and it does not replace a conversation with your healthcare provider. Every person is different, and your medical history matters. But what we're going to explore today could help you ask smarter questions, avoid unnecessary risks, and focus on the screenings that truly improve quality of life. Many people assume that more testing automatically means better health. That's a common belief. After all, if a test can find a problem early, why wouldn't we want it? The reality is more complicated. As we age, our bodies naturally develop small abnormalities. Many of these changes are harmless and would never cause symptoms. Yet once a test finds them, they can trigger a cascade of follow-up scans, biopsies, medications, and surgeries. Doctors even have a term for this phenomenon. They call it overdiagnosis. Overdiagnosis happens when a test discovers a condition that would never have affected your health during your lifetime. But because it has a scary name, it often leads to treatment anyway. Imagine being told you have a suspicious spot, only to spend months worrying about it, undergoing additional procedures, and experiencing complications, only to learn later that it never would have harmed you. That's why modern medicine is increasingly focused not just on finding disease, but on finding the right disease at the right time. Let's begin with a medical checkup that has become increasingly popular over the last decade, the full-body quartz scan. If you've ever seen advertisements promising to detect hidden diseases before symptoms appear, you've probably encountered marketing for these scans. The message is often very appealing. Find cancer before it starts. Detect life-threatening conditions early. Gain peace of mind. For many adults over 65, these promises sound impossible to ignore. After all, who wouldn't want an opportunity to catch a serious illness before it becomes dangerous? At first glance, a full-body quartz scan seems like a perfect idea. You lie on a table for a short period of time, while advanced imaging technology creates detailed pictures of your body. The skin examines organs, blood vessels, bones, and tissues, searching for anything unusual. It sounds like the ultimate preventive health strategy. But here's what many people don't realize. Just because technology can find something doesn't mean finding it will improve your health. In fact, this is one of the most misunderstood concepts in modern medicine. Many doctors have become increasingly concerned about the widespread use of full-body quartz scans in healthy individuals who have no symptoms and no specific medical concerns. Why? Because these scans often discover things that were never going to cause a problem. Let's talk about what happens as we age. The human body changes naturally over time. Tiny cysts may appear in the kidneys. Small nodules can develop in the lungs. Minor abnormalities may show up in the liver. Calcifications can appear in blood vessels. Most of these findings are harmless. In many cases, they are simply part of normal aging. If these abnormalities had never been discovered, they would never have affected a person's health or quality of life. Yet once a scan reveals them, a chain reaction often begins. Doctors call these findings incidental findings. An incidental finding is something discovered accidentally while looking for something else. Imagine you're cleaning your attic and find an old box you've never noticed before. Suddenly you're curious. You open it. Then you spend hours investigating what's inside. Many incidental findings work the same way. A scan reveals a tiny spot. Nobody knows exactly what it is. So more testing is ordered. Then perhaps another scan. Maybe a biopsy. Maybe a specialist consultation. Maybe even surgery. All because of something that may never have mattered in the first place. Now let's imagine a real-world scenario. Meet Robert. Robert is 69 years old. He's active. He walks every morning. His blood pressure is under control. He has no symptoms and generally feels great. One day he sees an advertisement promoting a full-body quartz scan. The ad suggests that hidden diseases can exist without warning. Concerned about his future, Robert decides to schedule the scan. A week later, he receives a phone call. The scan found a small nodule in one of his lungs. Immediately, anxiety sets in. The word nodule sounds frightening. His mind jumps to the worst possible conclusion. Cancer. Even though the doctors explain that most lung nodules are benign, Robert struggles to stop worrying. Over the next several months, he undergoes additional scans. Each appointment brings more uncertainty. Eventually, doctors determine that the nodule is harmless. No treatment is needed. Nothing dangerous was ever present. Yet Robert spent months living with fear and stress. This scenario is incredibly common. Sometimes the emotional consequences of testing can be just as significant as the physical ones. Another concern involves false positives. A false positive occurs when a test suggests a problem exists when it actually doesn't. No medical test is perfect. Even highly sophisticated imaging technologies produce false alarms. The more tests you perform, the greater the chance of discovering something questionable. And when a questionable finding appears, it often leads to more investigations. Many people assume that additional testing is harmless. Unfortunately, that's not always true. Some follow-up procedures carry real risks. Biopsies can cause bleeding. Certain procedures can lead to infections. Surgeries carry risks related to anesthesia and recovery. Even routine interventions can sometimes result in complications. This creates an important question. If the original finding was never dangerous, was the risk worth taking? For many patients, the answer becomes clear only after they've already gone through the process. Another issue that deserves attention is radiation exposure. CT scans use ionizing radiation to create detailed images. While a single scan generally exposes a person to a relatively small amount of radiation, repeated scans over time increase cumulative exposure. Most experts agree that medical imaging is incredibly valuable when it serves a clear purpose. For example, if a patient experiences unexplained symptoms, a CT scan may help identify a serious condition and guide treatment. In those situations, the benefits usually outweigh the risks. But when healthy individuals undergo scans without any specific reason, the balance becomes less favorable. The question shifts from what might we find to will finding it actually help? And surprisingly often, the answer is no. There's another concept that many people have never heard of. It's called overdiagnosis. Overdiagnosis occurs when a condition is detected that would never have caused symptoms or harm during a person's lifetime. This is different from a false positive. The condition may actually exist. However, it is so slow-growing or insignificant that it never would have become a problem. Yet once it's diagnosed, treatment often follows. And treatment itself can create side effects, complications, and stress. Think about that for a moment. A person can undergo procedures, medications, and surgeries for a condition that never would have affected them in the first place. That's one reason why modern medicine is becoming more selective about who should be screened and when. The goal isn't simply to find abnormalities. The goal is to improve health outcomes. Those are not always the same thing. Some people may be wondering, if full-body scans aren't recommended for healthy adults, what should I do instead? That's an excellent question. The answer is actually much simpler than many people expect. Focus on proven strategies that have consistently demonstrated benefits. Maintain healthy blood pressure. Monitor cholesterol, when appropriate. Manage diabetes effectively. Exercise regularly. Eat nutritious foods. Get sufficient sleep. Avoid smoking. Maintain a healthy weight. Stay socially connected. Manage stress. These habits may not sound as exciting as advanced imaging technology. They don't produce dramatic pictures or impressive reports, but they are among the most powerful predictors of long-term health. Research consistently shows that lifestyle factors play a major role in determining quality of life and longevity. A daily walk may not seem revolutionary, yet over years and decades, it can dramatically reduce the risk of heart disease, diabetes, falls, and cognitive decline. The same can be said for healthy eating, adequate sleep, strength training, regular preventive care. These interventions often deliver far greater benefits than searching for problems that may not exist. It's also important to understand that evidence-based screening is very different from random screening. Certain tests have strong scientific support because they've been shown to save lives in specific populations. Those tests are targeted. They are recommended for particular age groups and risk profiles. A full-body CT scan, however, examines everything at once without focusing on a specific concern. That broad approach may sound comprehensive, but it often creates more confusion than clarity. Think of it this way: imagine you're looking for a single missing document in your home. Searching the appropriate room makes sense. Tearing apart every room, every closet, and every drawer may uncover dozens of unrelated items that distract you from your original goal. Medicine works similarly. The best testing strategies are focused, intentional, and supported by evidence. Before scheduling any screening test, consider asking your healthcare provider a few important questions. What problem is this test looking for? Has this test been shown to improve outcomes for someone my age? What happens if the test finds something unexpected? Could the results lead to additional procedures? What are the risks compared to the benefits? These questions help transform patients into informed participants in their healthcare decisions. And informed patients often make better decisions. At the end of the day, health isn't about finding every tiny imperfection inside the body. If that were the goal, almost everyone would be diagnosed with something. Health is about maintaining function, independence, energy, mobility, and quality of life. It's about enjoying time with family, pursuing hobbies, traveling, remaining active, living with confidence. In fact, they may sometimes move them farther away. The smartest healthcare decisions aren't always the ones that involve the most technology. Sometimes the wisest decision is recognizing when enough information is already enough. And that's why, for many healthy seniors without symptoms, a full-body CT scan is a medical checkup many doctors would think twice about recommending. The goal isn't to avoid healthcare. The goal is to focus on healthcare that truly makes a difference. And that's a lesson worth remembering at every stage of life. Now let's move on to our next medical checkup that many experts believe deserves careful consideration after age 65. Routine PSA screening without a thorough discussion between the patient and their doctor. At first, this may sound surprising. After all, prostate cancer is one of the most common cancers affecting men. Most people know someone, a friend, brother, father, or neighbor has been diagnosed with it. Because of that, many men assume that regular PSA testing is an obvious decision. The logic seems simple. If prostate cancer can be detected early, then finding it sooner must always be better. But modern medicine has discovered that the story is far more complicated than that. To understand why, let's begin with a simple question. What exactly is a PSA test? PSA stands for prostate-specific antigen. It is a protein produced by the prostate gland, a small organ located below the bladder in men. A PSA test measures the amount of this protein in the blood. Higher PSA levels can sometimes be associated with prostate cancer. That sounds straightforward. But here's the challenge. Cancer is not the only thing that can raise PSA levels. In fact, many non-cancerous conditions can cause PSA numbers to increase. A naturally enlarged prostate, inflammation, infection, recent medical procedures, even aging itself. This means a high PSA result does not automatically mean cancer. Michael feels great. He exercises regularly. His blood pressure is well controlled. He enjoys spending time with his grandchildren and has no urinary symptoms or health concerns. During a routine visit, a PSA test is ordered without much discussion. A few days later, Michael receives a call. His PSA level is higher than expected. Immediately, anxiety takes over. The word cancer begins echoing in his mind. He struggles to sleep. He starts searching the internet. Every article seems more frightening than the last. Soon, he is referred to a specialist. Additional testing follows. More blood work, imaging studies. Eventually, a biopsy. Weeks turn into months. The emotional toll grows heavier. Finally, the results reveal a very small, slow-growing prostate cancer. Now Michael faces a difficult decision. Should he undergo treatment, or should he simply monitor the condition? This situation occurs thousands of times every year, and it highlights one of the biggest challenges surrounding PSA screening. Not all prostate cancers are the same. Some prostate cancers are aggressive. They grow rapidly. Without treatment, they can become life-threatening. These cancers absolutely need to be identified and managed appropriately. But many other prostate cancers behave very differently. Some grow so slowly that they may never cause symptoms. They may never spread. They may never affect a man's lifespan. In fact, numerous studies have shown that many older men live for years or even decades with small prostate cancers that never become dangerous. This creates a dilemma. A test may successfully detect cancer, but finding that cancer does not necessarily mean treatment will improve the person's life. And that concept can be difficult to understand. Most of us have been taught that cancer is always an emergency. We naturally assume that any cancer must be removed immediately. Yet prostate cancer often challenges that assumption. For some men, immediate treatment is the right choice. For others, aggressive treatment may provide little benefit while creating significant side effects. Let's talk about those side effects. Prostate cancer treatments can be highly effective. They save lives every year, but they can also carry risks. Surgery may affect urinary control. Some men experience leakage problems after treatment. Radiation therapy can sometimes lead to bowel issues. Sexual function may also be affected. Erectile dysfunction remains one of the most common concerns following prostate cancer treatment. These side effects can have a major impact on quality of life. That's why doctors increasingly focus on balancing benefits against potential harms. The goal is not simply to find disease. The goal is to improve outcomes. and sometimes those are very different things. This brings us to a concept called overdiagnosis. As we discussed earlier, overdiagnosis occurs when a condition is discovered that would never have caused harm during a person's lifetime. Prostate cancer is one of the most well-known examples. Some cancers grow so slowly that a man may die with the cancer rather than from the cancer. Yet once the diagnosis appears on paper, fear often drives treatment decisions. That fear is understandable. Few words in medicine create more anxiety than cancer. But fear alone does not always lead to the best decisions. This is one reason why medical experts not emphasize shared decision-making. Shared decision-making means the patient and doctor work together to evaluate risks, benefits, personal preferences, and overall health goals. Instead of automatically ordering a PSA test, the discussion becomes more personalized. How would he feel about monitoring a slow-growing cancer instead of treating it immediately? These conversations help ensure that screening decisions align with the individual's circumstances. Because there is no one-size-fits-all answer. Let's consider another example. Imagine two men who are both 70 years old. The first man is extremely healthy. He exercises daily. He has no major medical conditions. His doctors expect him to live many more years. The second man has several serious chronic illnesses that significantly affect his overall health. Even though both men are the same age, the benefits and risks of PSA screening may be very different for each of them. That's why age alone should never determine healthcare decisions. The bigger picture matters, overall health matters, life expectancy matters, personal priorities matter. Another important development in prostate cancer management is something called active surveillance. This approach has changed how many doctors handle low-risk prostate cancer. In the past, a cancer diagnosis often led directly to surgery or radiation. Today, many men with slow-growing prostate cancer may qualify for active surveillance instead. Active surveillance involves carefully monitoring the cancer over time. Regular PSA tests, periodic imaging, follow-up evaluations. The goal is to watch the cancer closely while avoiding unnecessary treatment. If the cancer remains stable, no immediate intervention may be needed. If it begins to grow or change, treatment can be started later. For many men, this strategy allows them to maintain their quality of life while still remaining protected. It represents a major shift in modern medicine. The focus is no longer simply finding cancer. The focus is understanding which cancers actually require treatment. Some viewers may be wondering, does this mean PSA testing is bad? Absolutely not. That is not the message. It also has potential drawbacks. Understanding both sides is essential. Think of PSA testing like any important life decision. You wouldn't buy a house, start a business, or make a major financial investment without understanding the possible outcomes. Healthcare decisions deserve the same level of thoughtfulness. The best decisions happen when people have complete information. Unfortunately, many patients only hear one side of the story. They hear about the possibility of detecting cancer, but they may never hear about false positives, overdiagnosis, unnecessary biopsies, potential treatment side effects. That's why education is so important. When patients understand the full picture, they are better equipped to make choices that fit their individual goals. It's also important to recognize that good health after 65 depends on much more than cancer screening. Many of the factors that have the greatest impact on longevity are surprisingly simple. Regular exercise, maintaining a healthy weight, managing blood pressure, controlling blood sugar, avoiding tobacco, staying socially connected, getting adequate sleep, reducing stress. These habits consistently improve overall health and reduce the risk of multiple diseases. They may not generate dramatic headlines, but their impact is enormous. A healthy lifestyle often provides benefits that no screening test can match. As we close this section, remember this important takeaway. The question is not whether PSA screening is good or bad. The real question is whether PSA screening is appropriate for a particular individual at a particular time. That decision should never be based on fear. It should never be automatic, and it should never happen without a meaningful discussion between the patient and their healthcare provider. Because when it comes to prostate health after 65, informed decisions are almost always better than automatic decisions.